with social distancing, hygiene, following the rules, the COVID-safe rules that allow us to both stay open and to stay safe. But we are still approaching that outbreak with the utmost vigilance and caution. And we are still prepared for the possibility of more locally acquired cases within those rings of personal close contacts and secondary close contacts. And I want to thank the many thousands of Victorians who are doing the right thing of isolating at home, making sure that they stay safe, keep themselves safe, keep their families safe, and keep all Victorians safe through that effort. We will continue to work through the list of exposure sites that have been listed on the Department of Health's website. And in that regard, last night the department published one low-level Tier 3 additional exposure site, meaning that those people who may have attended that site need to present, if they monitor their system, monitor their conditions and keep an eye on any symptoms they might have. That site is the Coles Express service station at 21 Ardina Court in East Boundary Road, East Bentley. That is opposite the GSAC Swimming and Recreational Centre. And that is between 1 p.m. and 1:40 p.m. on the 18th of February. That site is linked to one of the individuals who was announced and tested positive in recent days, the most recent family. That family were completely doing the right thing, were on their way to their drive-through testing, sanitised before going in, wore a face mask, sanitised on the way out, as the department's investigative team have established a low-level Tier 3 risk, but for the sake of an abundance of caution and making sure that everyone is fully aware of all the risks that we share as a community, we've listed that site. We encourage everyone to just continue to monitor the exposure sites webpage on coronavirus.vic.gov.au, just to keep an eye on how we're progressively clearing sites over the management of this outbreak. And that is an important thing that we should all be doing, just to make sure that out of an abundance of caution, we take the last steps necessary to run this Holiday Inn cluster down. In regards to our updating of the reports on the number of primary and secondary close contacts, we have now over 3,000 primary close contacts associated with the Holiday Inn outbreak, 59 primary close contacts from the immediate households or immediate social contacts, 1,361 from those list of exposure sites that we've gone through, and the remainder are from the hotel quarantining site at particularly Terminal 4 and at Melbourne Airport. We are making significant progress in clearing those primary close contacts at Melbourne Airport through the work of the coronavirus detective teams in working through the patterns. As we established earlier in the week, the fact that the entire Brunetti's workforce have tested negative and that the social contacts around that also tested negative continue to point in a reassuring direction, and the testing of those primary close contacts and other close contacts continues to give the public health team confidence, but it's not over until we've run this all the way down to day 11 and day 14 testing. There are some 485 incoming and departing passengers from that Terminal 4 arrangement that have been contacted about these arrangements, and that continues to only return negative tests as well. Another of the large exposure sites was, of course, the Queen Victoria Market, which we stress is safe and open and should not be anything other than a vibrant hub today. We've currently identified some 212 close primary contacts around that facility, and there continue to be no negative, only negative cases associated with that. 71 of this 212 are staff and students at St Aloysius Primary School in Ballarat. They have all tested negative and they are due for their Day 11 tests on Monday. And we thank that school for the exemplary way in which it has helped out through our public health team in the Ballarat community and supported each other in going through their isolation period in this time. And finally, in regards to exposure sites, 27 of the people associated with the private function at Coburg, that is those who didn't test positive, have now continued to return negative tests through their Day 11 tests, which is also reassuring. Our contact tracing team has worked hard over the course of this Holiday Inn cluster and have built a register of over 3,000 people associated through primary close contacts with that outbreak, and I want to thank them for their work, but more importantly I want to thank those 3,000 people who have really been the heroes of how we've responded to this cluster, have kept themselves isolated, have been supported in that, and through doing that have made sure that the short, sharp circuit breaker that was in place has achieved what we wanted it to do. Allowed us to get ahead of particularly this UK variant and its hyper infectivity, and got us to the point now, all being well, by following the rules, that we are hopeful that we can close this out over coming days. In regards to the benchmarks, up until recent times, where we've been running over the course of this cluster of some 99.7% of returns of getting in contact and identifying cases within the 48-hour national benchmark. Over more recent days, as the numbers come down, we've of course made that 100% of the national benchmarks. So my message is the numbers are positive. The numbers are reinforcing that we are getting on top of this, but it's not over until we get out the other side of the Day 11 and Day 14 testing of these 3,000 people who are doing the right thing for all Victorians, for them, for their families and for themselves, and I want to thank them. I'll hand over to Brett to talk about both some wastewater outcomes and the vaccination rollouts. Thanks.
Thanks, Minister, and good morning. So we have had some unexpected wastewater detections in recent days that we've told you about. There's no obvious connection between these locations and known cases. So we do ask anyone who's lived in these areas or visited these areas to be really vigilant for the mildest of symptoms and to get tested, as we always prompt anyone. The sampling has been taken over various days, and I'll just list the ranges. So 13 to 15 February, Wanturna South, Boronia, including parts of Bayswater, Ferntree Gully, Knoxfield and Tremont, have had a detection. Over 13 to 16 February, St Kilda East, Caulfield North, Caulfield, Balaclava and Elstonwick have had a detection. And 13 to 17 February, Carrum Downs, Langwarrin and Skye. And for these last locations, Carrum Downs, Langwarrin and Skye, there have been detections for a second consecutive day. So really important, especially for those listed areas, that if there are any symptoms, please get tested and you'll get a result very quickly. We do have wastewater monitoring now at 132 locations across Victoria. That includes 71 wastewater treatment plants and 61 sites within the Melbourne Metro sewage networks. It does give us signals, but it's not definitive evidence. You really need to get tested. That will give us definitive evidence of any cases that might be missed out there. When we get a detection in sewage, it might mean that there's a recovered case, but it can also mean that we've missed someone because they are positive, but they haven't yet been tested. Maybe because they've got very mild symptoms, but coronavirus can also cause very mild symptoms, so testing is a really critical component. We have stood down our rapid response teams in Sunbury, Point Cook and Coburg because there are no wait times that have really blown out at all in recent days. Our surge capacity has meant that it's really in hand. 6 sites were suspended yesterday for a period due to heat that we've always managed and had diversions to nearby sites. But over this weekend, again, any symptoms, sore throat, runny nose, dry cough, headache, muscle aches and pains, fever, please get tested, and you're very likely to get a result the same day or early the next day. Lastly, to the vaccine, you've heard me talking about getting out of the idea that we need to chase down primary close contacts, quarantine thousands of primary and secondary close contacts. The answer to this is the vaccination program. It does commence across Australia from Monday, including in Victoria. We're absolutely committed to working with the Commonwealth on this program, and it's really exciting to see that start next week. The priority cohorts for vaccination are our hotel quarantine workers, the port of entry workers and frontline health staff. They are the individuals most likely to come into contact with a suspected or confirmed COVID case by virtue of where they work. We'll also commence vaccinating public sector aged care staff and residents, and the Commonwealth are obviously responsible for private aged care in the disability sector. As new supplies of vaccine are approved, manufactured and provided by the Commonwealth, we're ready and able to expand the rollout even further. We're absolutely excited about the program and can't wait to get started. With regard to ease restrictions, just a reminder for those planning their Saturday night, there are still a number of conditions in place. You need to wear a mask indoors. You need to wear a mask outdoors where you can't physically distance. So if you're going out, please remember that, especially in those indoor settings. If you're having people over, that number can't exceed 5. If you're going camping with a big group, it can't be more than 20 individuals. Those will obviously be reviewed at the end of next week, but those are the conditions currently in place. They are important conditions because of the risk in those particular gatherings. And make sure you use the QR code to check in. That has been useful in our contact tracing through this outbreak, through previous outbreaks. So really important that you do that when you're checking into any venue that has them. That's how we stay open, and that's how we stop transmission. Thank you.